All right, here we go. Thanks guys for jumping on. And as we continue our series of the emotions, this 10-part series, this is number 2. Last week, last month, I'm going to do that all the time, just so you guys know. Last month, Sean talked about the brain anatomy and physiology, and that kind of set the framework for where we're going here in the future. Tonight, we're going to talk about anxiety and depression. We thought that was just the next place to go. And you'll see, I'll throw some stuff at you here in a little bit. But for those of you who don't know me, my name is Angelo. My wife Elaine is in the living room hosting a few other folks that decided to come over and watch over here. So we've been using essential oils for over 9 years now, and it literally has changed the way we do a lot of things. We have been totally blessed by what we've learned, and we've been sharing with others as we go along, and that's kind of why we're here, right? John, if you want to introduce yourself real quick, and then we'll get going on the left.
Sure. My name is Sean Page. Angelo introduced me to essential oils right around 2015. And I have to say I was skeptical at first, but then slowly adding things in and conditions that were told to me that will never be treatable and I'm going to lose the use of my hands. Well, that never happened. Background is I come from biochemistry and I am a nurse practitioner, board certified in family practice. So he picks my brain a lot, people. So I'm withering away here.
I do. And I am so grateful to have you as a friend and a resource. So
I'm glad that I have you, because without you and Elaine and a few others that I met early on, I wouldn't be here.
Well, thank you for that. So, all right, so here we go. I am going to start sharing my screen, and we are going to just jump right into this. You guys let me know if you can see my screen.
I'm good with that, Angelo.
Okay. My computer is not. There we go.
Yep.
All right.
Good.
So here we are, anxiety and depression. This is who we are. This is Sean and I. We're going to jump right into it. Before we jump too far, I want you guys to know that we're going to make a little declaration here, right? Is we love using the doTERRA essential oils, but we're going to make a claim here. We're going to make a declaration. It's not our intent, nor are we in any way attempting to diagnose, cure, advise, or prescribe of any human disease, ailment, injury, infirmity, deformity, pain, or any other condition, physical or mental, real or imaginary, by any means or instrumentally, right? We're just disseminating information because this is information and knowledge that has blessed our lives and our families, and we just want to share this information with you, right? So, I thought this would be a good place to kind of kick it off. If anybody who knows me knows that I am a big fan, Elaine and I both are big fans of the FLCCC Alliance. And we were watching a Zoom probably a month ago now, and they did a quick synopsis of some of the anxiety and depression that's happening with children. And you can, this study is available on the PubMed website, but here's some of the numbers that was presented in this. In March and April of 2020, mental health claims for 13 to 8-year-olds approximately doubled from that of 2019. For 6 to 12-year-olds, November 2020 significantly had a significant increase in the OCD and tic disorders. April of 2020, generalized anxiety disorder was up 93% from April of 2019. Major depression disorder was up 83%. In February 2020, suicide attempts were up. In March of 2020, attempts had increased, and they actually almost doubled from March of 2019, and they kind of stayed elevated through the summer. And here's another statistic that I just learned. 2020 and 2021 versus the previous decade, we have had a significant decline in verbal, motor, and overall cognitive performance in newborns versus pre-pandemic. I don't know if you guys had seen the news, but the CDC had lowered the bar for infants. They no longer annotate crawling as a milestone. They've extended the time frame for an infant to walk, and they've also lowered the numbers in the vocabulary that a toddler should learn from 70 words, and I forget the age it was, but they lowered it from 70 words to 50 words. So they lowered the bar to make it look like you have an adequate child, and I just don't think that's the right way to handle where we are. We could do things a lot better and a lot smarter. So let's talk about anxious and anxiety and depression. And we hear those terms a lot. Oh, I'm anxious or I'm depressed. And it's rightfully so, right? Both of these emotions, they're normal emotions to experience. They routinely occur in response to high stakes or potentially dangerous situations in the case of anxiety, or disappointing or upsetting circumstances in the case of depression, right? So the relationship between these emotions, it's complex, but they're also somewhat idiosyncratic, right? Meaning that they're very individualized and very specific to said individual. So one person who's experienced anxiety can lead to avoidance and isolation. Isolation can result in a lack of opportunity for pleasurable experiences. I'm going to repeat that again, because I think in the last 2 years, everybody falls into this, right? Isolation can result in a lack of an opportunity for pleasurable experiences. This leads to that low mood. But for others, the emotions may flow in the opposite direction. Feeling down may zap somebody of the energy to do things that they typically enjoyed, or an attempt to maybe re-engage into the world may be difficult and make them a little bit nervous at this time. So even though anxiety and depression share some of the symptoms, some of the causes, and even some of the treatments, it's important that we understand that there is a big difference between the two of them.
Something else to point out there, Angelo, and I missed this when we were prepping, is we also see an increase in entertaining high-risk behaviors that we normally would never have engaged in before.
Very true, very true. So let's look at the relationship between anxiety and depression. They share a kind of a biological basis, right? Persistent states of anxiety and depression involve changes in that neurotransmitter function. We're going to talk a little bit more, dive a little deeper in that here in a minute. But the lower serotonin levels are thought to play a role in both, along with the other brain chemicals such as dopamine and epinephrine. Anxiety and depression can occur sequentially, meaning one in reaction to another, or they can be co-occur. When anxiety and mood problems reach the threshold for that clinical diagnosis simultaneously, the specific diagnoses are considered comorbid, or basically one individual having both anxiety and depression. Sean summed it up really well. He said, think of this as there's a very short window where anxiety exists kind of independently of depression. And if it's left unchecked, that's when it triggers the depression. So we want to think of anxiety as the fuse and depression as the bomb. Anxiety versus depression is kind of a complicated subject. And it's very important to recognize how often these conditions are different, but how often they're similar. Psychologists generally look at both and try to differentiate the major problems as well as figure out how to treat them. And I thought this picture on this slide was pretty explanatory, as to see what's happening with somebody who's very anxious versus somebody who's feeling very depressed. And it's kind of, we're going to kind of dive into this a little bit deeper. We could park right here and cover probably 80% of the things we want to talk about, but I'm not going to do that. We are going to dive down into all of this information, but this is a great slide that I think is just kind of like the one-stop shop. If you want to take a screenshot of this or take a picture of this, this is the one-page comparison for anxiety and depression. But we're going to kind of break this down a little bit more as we continue on. So some of the, again, continuing with the similarities and the differences, anxiety and depression have very distinct psychological features. Their mental markers are different. If you compare the two lists of symptoms that you see here, you can see that there is some overlap, right? And that's normal. But it's also arguable that sometimes people can take that disturbance in sleep or appetite, and that they can move that also into the middle, because we see a lot of that with both depression and anxiety. And it's also, I want to note that irritability can also manifest in forms of anxiety or depression too. It's just something that can come about. So let's look at a little bit more at these mental markers, right? So when we look at somebody who has anxiety, one of the mental markers we have is worry, and they worry about the immediate and maybe even the long-term future things. They have uncontrollable racing thoughts about something that could potentially go wrong. And they avoid any kind of situations that could cause their anxiety level to increase or have those feelings start to consume them. They'll also have this thought about death, but here's the caveat to that. They think about death in a sense of fearing death due to the perceived danger or the physical symptoms or the anticipated dangerous outcomes. So it's everything is just kind of perceived in this. So they get a little bit excited with that. Depending on the nature of the anxiety, these mental markers can vary. For example, somebody with generalized anxiety disorder can worry about a variety of topics, a variety of events, and a variety of activities. A person that has social anxiety disorder, on the other hand, is more apt to fear negative evaluation or rejection by others. And so they're going to be a little apprehensive of going out and meeting new people and kind of doing new things. If you want to put it in kind of simplistic terms, people with anxiety are mentally preoccupied with worry to a degree that is totally disproportionate to the actual risk or reality of the event. When we look at the mental markers of depression, we see that a big one is that they feel hopeless. And this is because they're assuming that nothing positive will happen in their future for themselves, for others, or maybe even for the rest of the world. They just have this complete sense of hopelessness. They believe that it's not worth trying to think or to feel differently because of this hopelessness, this overwhelming feeling of hopelessness. This individual can sometimes feel worthless, as if they are, no matter what they do or what they say, that just doesn't matter. They're not of any value to anybody. They too think about death, but they think about it in a persistent belief that life is not worth living and that the individual is considered a burden on everybody else. In cases of that moderate to severe depression, more specific suicidal thoughts can be present for that individual. Somebody who's suffering from major depressive disorder, these types of thoughts are persistent most of the day and more days than not for weeks on end. If a person changes between the very high and the very low mood state, then we got a diagnosis usually of somebody who's bipolar. For any variant of these mood disorders, the low mood state is likely to be characterized by the thinking that I just talked to you about here. Let's jump back to some of the physical signs that go along with somebody who's feeling anxious or depressed. The physical signs of anxiety can be conceptualized as that kind of that heightened arousal, right? Some of the specific characteristics will include difficulty concentrating due to the state of aggregation and racing thoughts. Can whoever has the mic on here, go ahead and mute your mic for me?
I do hope I'm on mute.
All right. Thank you. Again, physical signs for anxiety. Some of the things you're going to see: difficulty falling or staying asleep due to these racing thoughts or some other physical symptoms. They may have signs of symptoms of feeling dizzy. There could be some gastrointestinal distress with nausea, diarrhea, or constipation. Definitely going to see an increased heart rate, blood pressure, maybe even some sweating, some muscle tension going on, and they may feel this shortness of breath that starts to come over them. Some of the physical signs of depression, as those physical characteristics that you're going to see with those folks, they may have difficulty with concentration, focus, or memory, just due to this ruminative thought process and these other physical symptoms. You're definitely going to see a lack of energy, some physical achiness without any kind of specific cause. And they're going to be sleeping. They may be sleeping a lot more. They may be sleeping a lot less, but it's typically due to this thought process and this low energy that they have going on. However, there are some distinguishing features, right? So people with depression typically move slowly and their reaction can seem kind of flattened or maybe even a little dull. But people with anxiety tend to be a little bit more keyed up as they struggle to manage and maintain those racing thoughts that they constantly have going through their minds.
Hey, Angelo.
Yeah.
Can you go back a slide, please?
Yep.
All right. So if you think of it as this way, anxiety is there's a threat that the body is perceiving. And so it's activating that fight or flight response. And if you look at everything, it's all that ramping up. The depression side is you've gone through your gas tank and you're basically working off of fumes right now. And as you know, we don't do very well off of fumes. So that's another perspective of looking at that.
Absolutely. Cool. Thanks, Sean.
Sure.
For those of you who were on last month, you guys may remember this slide. We talked about some of the neurotransmitters that the brain does and uses, and we're going to kind of dive back into here for a little bit. These are the chemical messengers that help promote that forward progression of that electrical signal within the pathway, right, of that neurotransmitters and that synapses that's going on. You can think of it as this nerve impulse that is going down the line, and it's going to maybe it's going to a target location. Like maybe that that the line is traveling down is going to a muscle where it's going to make that muscle contract, right? So the brain responds directly to these neurotransmitters, these little chemicals inside our body that send messages to our brain. And these messages are things that we tell us how we should feel, how we should think, how we should act, and so much more. There's a lot of neurotransmitters that are linked to anxiety. Neurotransmitters like serotonin, GABA, norepinephrine. Even dopamine may play a role into anxiety. That dopamine can have kind of a calming effect on those already living in that anxiety with those anxiety symptoms. Interestingly enough, we all know that the body likes balance. If we have too much or too little of something, of a hormone even, we know that this can affect the anxiety in a different way. So oftentimes it's people that have a problem with balance within the body. And if there's not enough serotonin, this can cause a person to experience some anxiety type symptoms. There are a lot of different hormones also that affect the brain chemistry and the neurotransmitters. So these hormones if these hormones are out of balance or out of whack, anxiety can be a result of that as well. Some of those examples of the hormones are adrenaline or epinephrine. Adrenaline is one of the most common causes of anxiety symptoms. Your body releases this. Sean was just talking about this, where the fight or flight, where body gets ramped up and it becomes very active. It causes that heart increase, the rise in blood pressure, the muscles become a little bit tense. And in some cases, long-term stress and anxiety may damage your ability to control that adrenaline, right? And this can lead to further complications with the anxiety symptoms. Thyroid hormone is another one that appears to, and it appears to be pretty important, because what it does is it regulates the amount of serotonin, norepinephrine, and here's the big one, the GABA, gamma. I'm not even going to try that. The GABA. It's produced and distilled and distributed to the brain. So problems with your thyroid may also increase the risk of developing anxiety. And Sean, you were just talking about this, I think yesterday to me, that you said when they're starting to look at people, when they're starting to evaluate and assess folks with depression and anxiety, they're starting to look at the thyroid in particularly, are they not?
Yeah, if we have a new onset patient that's coming in with depressive symptoms, and there's not really any other physiological cause, such as a death or some drama like that in the family, one of the first things we should look at is at thyroid hormones, because the two are so tightly linked together, and particularly in the elderly population. And there's so many people that we have found that were hypothyroid. You treated that, their depression miraculously went away.
That's just fascinating. It just continues to fascinate me in this world of emotions. So that was a little bit about anxiety. What are the effects of depression on the brain? Well, usually there's a loss of serotonin and dopamine that takes place, and the rates are a little bit different among people. So this is why we see some differences between individuals that are suffering from depression, because it's all happening at different rates, right? Because this results in a variation in the nature, the pattern, and the severity of the symptoms. But again, some of the neurotransmitters that we're looking at here, serotonin is responsible for inhibiting pain and the regulation of sleep, appetite, and mood. There is a direct connection between serotonin and the depression, in the sense that lower levels of serotonin lead to higher risks of suicide rates. Dopamine is another one. It's responsible for motivation, movement, and the perception of reality. Any problem in the transmission of dopamine in the brain, and this transmission would probably result in a depression associated with psychosis and maybe some substance abuse as well. Norepinephrine is another one, and it helps with recognizing and responding to those stressful events and those situations in life. Those with depression may not have the proper release and transmission of this neurotransmitter. And if they have this problem, they may not be able to handle stress very effectively in their lives. So the big question is, can we change how our brain works? And Sean just forwarded me a really nice article about something called cognitive brain therapy. There is some cognitive brain therapy that is being done for people that have generalized anxiety disorder, and they're finding it to be very effective. Sean just forwarded me a link about an hour before this class, and I was like, oh, that's fascinating stuff, but a little bit too late to incorporate into this. But CBT is a thing, and it works, and it's basically talks about rewiring your brain. And how do we rewire our brain? We do that kind of simply by changing our thought process. It's sometimes, we got to take that negativity and turn it around to something positive. And I make it very simplistic saying that, but in essence, that's kind of what it is. And we, do you have the ability to do that? The short answer is yes.
And let me jump in here, Angelo.
Yeah.
It's more powerful with the anxiety disorders than it is with and depression has levels. The deeper you go into the depression, it then starts getting to be a little bit mixed bag. But one of the initial therapies that they do pretty much for all CBT, when we are looking at the anxiety and depression, is going for gratitude. It's amazing finding 3 things that you're grateful for a day can quickly start rewriting the change. Psychologist friend of mine, he's been tracking some of this, and he has noticed changes within as little as 7 days.
Wow, that's pretty quick.
Yeah.
And that's kind of the gratitude can kind of go can kind of tag along with the affirmations that we're going to talk about here
Correct.
in a bit as well. So so let's talk about the treatment of the brain, treatment of anxiety and depression, and changing the brain. Now, most of the time when we talk about these SSRIs and NDRIs and all these other medications, these are usually associated, well, I can't say usually, they're associated with both anxiety and depression. Because both of those emotions trigger have the same issues with the same neurotransmitters, these medications can kind of be used for both situations. Things I want to point out, though, is that really what we're trying to do is balance the amount of cortisol in the brain to help the person stay in that sweet spot, so to speak. Some of the medications that you guys may be familiar with, selective serotonin uptake inhibitors, right? These change the serotonin levels in the brain, and they help reduce the symptoms of depression. The norepinephrine dopamine reuptake inhibitors. These drugs will increase the levels of norepinephrine and dopamine. Serotonin norepinephrine reuptake inhibitors and tricyclic antidepressants. I just want you guys to know that these sometimes, but not always, are not prescribed together. Sometimes we get just the SNRIs, other times we get the tricyclic antidepressants. But when they are taken together, these can help alter the levels of serotonin and norepinephrine in the brain, and this can help boost the mood and the energy levels. Atypical antidepressants. These include anything from tranquilizers, mood stabilizers, and antipsychotics, which help block brain cell communication and reduce the stress on the body. MAOIs is another one. These drugs increase the levels of norepinephrine, serotonin, and dopamine in the brain, which helps increase the brain cell communication. So these medications can be very effective. Many people are adjusted adjust very well to everyday living with these medications, but there's a lot of risks that go with these medications. As we know, there's always a lot of side effects that go with these, and when you start talking tricyclic medications or MAOIs, Sean, you were saying that these are kind of last-ditch efforts for medications for these people with some serious anxiety or depression issues.
Yeah, the SSRIs, the SNRIs are like our first go-to. Then we'll start looking at the NDRIs, and then if we may combine the SSRIs with an NDRI, or flip-flop back and forth. It's then, if we still need to add, then we'll start looking at the tricyclics or the atypicals. Which one's going to give us our better response based on the whole clinical picture? Problem is, the tricyclics and the MAOIs, as you mentioned, they have a lot of drug-drug interactions and aren't very well favored. The other thing that some of the literature points out is that tricyclic antidepressants can significantly increase the risk of suicides. either the thought thereof or actual completions.
Right. So, wow. Well, where's all the good news in this, right? So, um, we're gonna shift our focus now. We talked about kind of what anxiety and depression look like and what's happening with these neurotransmitters. And so now we're going to shift over to what can we use naturally to help help ourselves with these anxiety and depression moods, right? I'm actually going to start here. This is something I threw together, came from the Trislin and Young essential oil safety book. When we're talking medications, we can run into some problems with specific oils and specific medications. So we want to be very cognizant of that. There's no way, shape, or form are we trying to say that you can start taking these oils and your medications now, or you can come off your medications and start trying just the oils. You guys need to do your homework. You need to figure out what is going to work best for you. And we want to make sure we don't have any bad reactions to oils and medications. Sean uses this natural medicines database. This is something that it costs a pretty penny every year for him to have this. But Sean, remind me, what does this website enable you to do?
So it's kind of cool in the fact that they've looked at literature from around the world. Now they give it a therapeutic number. It's like 1 to 9, I think, scale, if I remember correctly. And how effective is it? But they will talk about, and the other thing I like about it is that you can actually search out for specific brands. So like I can put in and say, I want to limit to just doTERRA products, or I have a friend who uses the Young Living, so I can search out for that. But it also is like the PDR for many of the oils that we use. So gives some of the chemistry, gives what it is good for, anecdotal data, etc. But then it also gets down into, hey, it doesn't play well with this, that, or the other thing. There's also a feature that I could put in a person's profile of what medications that they take, as well as the essential oils, and look for drug oil interactions.
Yeah, so pretty extensive. And if you guys have questions, safety concerns concerning oils and medications and whatnot, feel free to reach out to Sean or myself, and we can dive into this, the book or into the database, just to make sure that we don't have any adverse reactions from that.
Oh, Angelo, one other thing. On the previous slide, you said about going back on or dropping down or trying to get off medications. And I kind of feel I'm betraying my profession, but some of these medications are really, really nasty, both short as well as long term. The one thing about the any of the psych medications, whether we're using it for depression, schizophrenia, whatnot, it's not just something you just stop. You have to build up slowly and you have to taper down slowly. So if you're like at 80 milligrams of one of the SSRIs, just don't think, oh, I'm going to start the essential oils and I'm stopping it tomorrow. You will create a heck of a mess for yourself.
Absolutely, absolutely. It's all part of trying to keep that body in balance. So just we can't caution you guys enough when it comes to this. So let's talk about some of the oils or some of the other products we can use. Now, Sean and I like this emotions wheel. We get it from the Emotions and Essential Oils wheel. It's a book that follows, it gives a lot of information on the emotional aspects of the oils. This is kind of how we got which topics we're going to talk about during this 10-part series. But Elaine more so noted early on, we've been doing mood lessons for a while. And one of the things that Elaine caught on very quickly was when you're feeling anxious or depressed, it's too late to go figure out which oil or which product you want to use. When you're anxious or when you're depressed, you don't want to look that stuff up. It's not going to work. You need to do your homework before you go into those, before those events happen. And you need to figure out what oils or which products work well for you, so that when those anxious moments come over, or when you go into that deeper depression, all you have to do is reach for the oil or reach for the product and use it. So that's the homework that you guys have to do with this, right?
Something else here to comment on that, Angelo, is take a look at how you have responded with anxiety and or depression before. For the most part, it's very predictable patterns. And so if you know what those patterns are, you can then start pairing those oils with the responses that you're trying to achieve or prevent.
That's excellent. Cool. Thanks, Sean. Oh,
Sure.
Look, I got a little buddy now.
I see that.
So these are just a handful of different oils that you can use. I love the frankincense and the sandalwood. When in doubt, you frankincense out, but those are really good for brain function and repair. And what I love about those is they cross that blood-brain barrier. And again, that was something that Sean talked about last month. I found that Thinker, it's one of the kids blends, that it supports brain function. The adaptive line that came out, I think this has been phenomenal for a lot of people. The adaptive capsules, you can see there, it helps support relaxation and encouragement. One of the things I did want to read to you straight out of the book, I was looking up the adaptive capsules in the Essential Life book. And it talks about what it's good for and the ingredients that are in there. And it specifically has GABA in there, and it states that it's quieting neurotransmitter, promotes relaxation through natural comforting effects, helps reduce feelings of apprehension and fear by decreasing the neuronal excitability, moving the brain and body into a lower gear by lowering activity and lowering the central nervous system. So that's why the adaptive is so beneficial to so many, because it specifically focuses on that GABA. So when I started putting this together, looking through my resources, I said, okay, so when people start feeling anxious, start having this anxiety attack come over them, what are some other words that they might be able to use to help transition, to get from that anxious level over to a better spot where they want to be? And some of those words that came to my mind were relaxation, releasing control, and empowerment. And I actually polled some folks in our Facebook group, got some excellent response from that. And when you look at those words, as far as relaxation goes, that's actually Aroma Touch oil. It is the oil of relaxation. When we look at wanting to release control, cilantro is the releasing control oil, right? Ginger is the oil for empowerment. And what was fascinating is I always, every time I do a poll, I always say, add your own, right? In case I missed something. And Donna Rump came back with deep controlled breathing. And I thought that was spot on, because that's actually something we're going to talk about a little bit later. Now, I mentioned something about affirmations earlier, and affirmations are huge. This is where we kind of start rewiring the brain. Sean was talking about gratitude. Affirmations can help with this too. Affirmations can be very powerful. However, you kind of got to know how to use them. And what I mean by that is, I didn't think much of affirmations at first. I was like, okay, cool. And I read them and I was like, oh, those are some neat words, or those are some neat sayings. And I can see where an individual would be able to get from one place to another, but I never kind of put a lot of weight on them. And then as I started learning more about just everything, about the emotions, about the oils, and I kept going back to affirmations. This wasn't just for the emotions part either. It was affirmations I started seeing that across the board on a lot of different things. So I gave it a little bit more thought, gave it more attention. And as I started looking at it deeper, I said, you know what? I've been doing this all wrong. I've just been kind of reading them and going, cool, and then move on. These are some pretty powerful things. But one of the things that you need to do when it comes to saying affirmations, I often hear saying them out loud makes it so much more impactful and more meaningful than if you just kind of say it to yourself. And really, truly reading the words, getting the meaning, extracting the meaning of that affirmation can be extremely powerful for somebody. My favorite one is the third one on this screen. And it says, I am confident in my ability to handle this situation and accomplish what I need to accomplish. I calmly process information. I am enough. More often than not, the world is telling us we are never enough. Being true to yourself, being true to what you can and can't do is going to get you pretty far in life. So affirmations, these are just a few affirmations that can be helpful for anxiety. And you can come up with your own very easily. There's so much information out there, good stuff that you can pull from books and from different websites, but affirmations carry a lot of weight.
Some comments on the affirmations.
Yeah.
I do like how you said, make sure that you read it out loud. However, the other thing that's important with that is read it slowly and methodically. We could read, I am confident in my ability to handle the situation and accomplish what I need, et cetera, et cetera, et cetera. That does not have the impact. The brain has to take it slowly. So you want to, I am confident in my ability. And so you're seeing some inflections where you're trying to show those positive aspects. The other thing is read it 3 times.
There you go. So some of the testimonies I got from the crew as I put it out there. Chris came back and said, for me, causation is key. If I'm stressed or anxious because there's too much to do, relaxation is helpful. If I'm anxious because of dreading something to come up, then I need to empower, then she needs empowerment to figure out how to handle it. Relaxation at that point would only make her dwell on it a little bit more. Charlotte says action. When I'm feeling anxious, it helps me to write out exactly what's making me feel and the way that, and then I can determine if any action on my part can change that situation. If action can resolve the problem, I make a plan. If there's nothing I can do, I look for a way to cope, usually by prayer, followed by a glass of Chardonnay. Well, can't fault you for that one at all. Janet came back and she said, all 3 in different measures with different causes. Things I can control, empowerment. Things I can't control, I'm going to release the control. When it starts to ramp up, relaxation. So I started seeing to where it's definitely a cause and effect, right? So we did the same thing with depression. We looked at some of the oils. Again, I kept releasing control there because sometimes I'm thinking people who are in a state of depression, maybe they just want to release that control. So again, it's the cilantro oil. Somebody came up with surrendering pain. That oil is deep blue. Somebody added, I did not add this to the group, but somebody added hope. And I thought, hope oil, that's fantastic. The hope oil is actually the oil for overcoming. And this encourages belief of a brighter day, right? It reassures that broken things can mend, hearts can heal, and lives can be restored. Again, we got a kids blend oil up there, Brave. That's the oil of courage. And then Lauren Jordan added releasing inner anger. And I thought, wow, that's a great one. What oil goes with that? So I had to do a little bit of digging, and I found out that cardamom is the oil of objectivity, and that helps to bring that balance, that mental clarity, and that objectivity during those moments of anger and frustration. So these are just kind of some oils that you can use, again, with the affirmations and the gratitude. Those are the things that could help transition, get you out of that funk and into a better spot. Here's a few of the affirmations that can go along with depression, right? Sometimes these are hard words to say to ourselves. Saying again out loud, saying them 3 times. I promise you'll probably notice a big difference between the first time you say it and the third time you say it, because you start believing in it and you start owning that. So how do we use these oils, right? Here's just a couple options that you can use. If you want to use something topically for anxiety, vetiver or myrrh right after a shower, put them behind your knee. The thickness, the viscosity, because these oils are so thick, they're going to take a while to gradually absorb. And this can, for some, it can last throughout the whole day. Others, you may need to apply it one or two more times. That's cool. One of the biggest things I seen with depression was diffuse. Do it often. This is one blend that you can put together. You can also put this blend in a veggie cap and take it that way. When it comes to diffusing, as you're trying to figure out which oils you like, which blends you like, a quick way to see if it's something that you want to diffuse is take those 2, 3, or 4 oils that you want to put in the diffuser and take the caps off and just kind of whiff it under your nose. If you like the smell of it, then go ahead and throw it in the diffuser. If you don't like the smell of it, swap an oil out, go with a different blend. This is just a few more recipes, depending on where you are and where you want to be and where you're trying to get to, right? This is a good opportunity here to grab a screenshot or take a picture of this. And again, it's like you notice with these, there's a lot of citrus oils that are involved with this. Citrus oils are high in linalool. Linalool is extremely effective when you start talking neurotransmitters and people that are feeling anxious or depressed. It kind of goes hand in hand. Now I'm going to turn it over to Sean for a little bit because he created these 2 blends on his own. It took a little bit of time to figure this out, didn't it, Sean?
Yeah, it did. A lot of this came out of the pandemic. One of my roles is as the health officer for the York County Office of Emergency Management. And even before we actually went into lockdown, so early March, late February, early March, my director called me in and says, "Hey, I think we got a problem." And I go, "Yes, we do." And he says, "Guess what? It's your problem." And so everything was thrown onto my shoulders very quickly. And so it's like, wow. The first couple of days I went in ripping and tearing. And after a while, it's like, this is going to be daunting. And then the lockdown came down on the 16th. So it's like, I got to do something to keep myself going. So playing around with the oils, and as you can see, Citrus Bliss, there's like 6 different citrus oils in there. And the adaptive, because of the properties that Angelo talked about before. But I also was pairing some of the emotions that I was feeling to choose these oils. And so like with the elevation, it was going to give me the encouragement, the accepting of this, being relieved and determined, while helping to diminish the anxiety and the defeatedness and the obsession, because this became very obsessive of mine. How am I going to overcome this? Now, unfortunately, Elevate was discontinued, what, last year, Angelo?
Yeah, it was last year.
Yeah, so Angelo found some possible substitutions for that. Now, for the evening, it's like, okay, I need to have something that kind of chills me out, mellows me down, make sure that I get a good sleep. And so we built this blend for myself, and I really like what it does. And I can tell you, if I forget to use either one of these, I just know. Now, treat these essential oils as a medication. And that's something that a lot of people don't realize, but it is a form of medicating ourselves. So like with any medication, we always want to start slow or start low and go slow. So start off with a 2.5% concentration and a 10 milliliter roller ball, as you can see there. And to help you out, we figured out the drops that you need. And then after a while, you may hit a period of time where you plateaued out. And so you then bump it up. Now you can go 2.5, 3, 4, but just to give you snapshots of where the progression is, you can kind of do the math in between there. So that's why we gave you that whole spectrum there to see that. Anything else you want me to say there, Angelo?
No, that's perfect. Thanks.
Okay.
On to the next one.
Sure. All right. So sometimes we're caught without our oils. My gosh, what do we do? The last thing you want to do is panic, particularly if you're in an anxiety attack situation. The one thing is breathing is essential to life. As much as my students try to keep telling me that breathing is optional, it is not. And blue does not become most of us unless you're a Smurf. So one of the things that I've used in the EMS field that I've worked in is box breathing. And it's amazing how quickly you can see a patient or a person de-escalate. Now, the trick about breathing is we need to do it in and out through our nose, because that movement of air in and out through our nose stimulates the parasympathetic nervous system. And remember, in anxiety, we're in that excited state. So, which is the sympathetic nervous system. What I want to do is make myself go into that rest and digest mode to chill myself out. So what we're going to do is and do this with me, please. So you're going to close your eyes, all right? Minimize the amount of stimulation that's coming into you. Now, in through your nose, you're going to inhale for a total of 4 seconds, all right? And count it out to yourself in your mind, all right? Then once you're at peak inspiration and fill up from the belly and then your chest, hold it for 4 seconds. Then exhale slowly for 4 seconds. And then hold that exhale for 4 seconds. And then repeat this. And you'd be surprised what 5 breaths doing this will do. This was a trick that was shared with me with United States Navy SEAL. They train all Navy SEALs in this technique. And I started doing some digging around. It's like, yeah, this works. Now, if you have some respiratory issues and you don't have that vital capacity, 2 seconds the whole way around, and then build it up to 3, and then go to 4. There's some other people out there that are pushing for 8 seconds. I will tell you what, that is super, super difficult to do. 4 seconds is what most of the research is based off of, and it has been found to be the most effective. Now, what happens if you have that? Donna has a question here. Or change to inhale shorter than exhale. You can do that as well, Donna. Yeah. However, that whole 4 seconds the whole way around is what builds your box, and that's what's really kicks that parasympathetic nervous system into full gear. Yeah, she has inhale 4, hold 4, exhale 7. Yeah, I've seen that written as well. All right, so what happens if you have a child? All right, or you have somebody that may not have full mental faculties and has a learning disability. I really like this one. So stretch your hand out, put it out in front of you. All right, so like it's a starfish, and take your index finger of the other hand and start at the base of the thumb. Now, as you trace up your thumb, you're going to inhale, And when you get to the tip of your thumb, just take a pause. And now start to exhale and trace down into that webbing. Take another pause. Go up the index finger and pause. And as you go up, you inhale. And as you go down to the webbing between the fingers, you exhale. Take a short pause and go up, pause, out, pause. Inhale, pause, exhale, pause, until you come down to the pinky side of your hand and finish that. That's 5 breaths. That's all it takes in most cases to kick that nervous system in to get people to relax. All right, so you can do this yourself, but it also works very, very well with kids, as Angelo found this great pictorial here. So it works better if you're seated. Can you do it laying down? Yeah, not as effective, but it will work. And so what you're going to first do is you want to scrunch your face up and make it as tight. Some of the things that we've done is make it as grotesque as you can make it. Make a monster face, whatever, but then allow them to relax. Now, the other thing that's not on this part of the slide is we want them to breathe in and out through their nose. That is key to this. Now, let's tense our arms. So put them out, make fists, and make their arms as tight as possible. If you have a kid that really likes to show off, have him try to flex his muscles so that he's becoming the Incredible Hulk. Then let them relax and fall on your lap. Then again, you can see the shoulders and bring the chest in. As much as I don't like compressing the chest, squeeze that chest together, all right? And then bring back. And you can also alternate with the shoulders up and forward, but also up and back, all right? I like that combination. Then do the same thing with tensing up your legs and then relaxing. And again, breathe in and out through this whole cycle. All right. Angela, are you drawing? Because
no, I'm not. I'm not sure what happened there, but
okay. Just all of a sudden I see lines everywhere. All right. Another technique that comes from Chinese medicine is we have, you've probably heard of acupuncture. And in Chinese medicine, there are these things called meridians, and they control various parts of our body. So one of the things that we can tap into is the middle finger of both of our hands are part of the pericardial meridian. And I'm starting to dive a little bit deeper. So give me a moment as I pull this together. So anyhow, the other thing that we have is something called our third eye chakra. And as you can see here, I need to move my windows here. Our third eye is our inner sight, right? It gives us a lot of our intuition, and it's directly related to our pineal gland. So if we have a lot of stuff going on, it then starts shutting down. So we don't have that intuition. We don't have that foresight. It brings about that depression. We don't have clearer thoughts. We tend to lose our discipline and just become vegetative, so to speak. And if it gets bad enough, yes, we can have panic attacks. So the mentality here is to take your right middle finger and place this on your third eye, which is right above where the eyebrows meet. And then your left middle finger goes onto your navel, umbilicus, belly button, whatever you wish to call it today. And then close your eyes. And again, in through the nose and out through the mouth 5 times. Slow, deep, deliberate breaths, just focusing on the breaths. And very quickly again, we start to see those stimulations chill us out and allow us to get control of ourselves.
Cool. Excellent techniques we can use when we don't have our oils. So as I was showing this to Sean, we're collaborating back and forth. He came back with and he said, "Hey, Ange, you never mentioned anything about diet or exercise." And some of the things I was reading was, well, depending on diet or exercise, they play into it, but not very much. That was the information I was finding. But then Sean finds this PubMed study that says exercise releases those endorphins, and we have that norepi and that dopamine that's released. So that is definitely going to help us with that, with those sensations of anxiety or depression. Gut health. Oh my God, you guys know how I feel about gut health. And you can see where almost 70% of our serotonin is derived from our gut. PB Assist can help with that. PB Assist Junior for the kids. And of course, LLV, I think it's just phenomenal and instrumental in that foundational nutrition, so that our body can better utilize the nutrients and absorb the things and metabolize the things that it needs to. So diet and exercise do truly play into this as well.
And for those who aren't familiar, 5-HT is the abbreviation for serotonin. And Angela and I were privileged to be part of a Zoom meeting last night with Dr. Brannick Riggs, and he was so emphatic about the LLV product, because without this, pretty much else, nothing works.
Yeah,
that I think was the take-home message she was trying to give there. Don't you think, Angelo?
yeah. The stuff will work, but it will work so minimal.
Right.
Everything will be so much more beneficial and impact your overall health better if you are on some type of the LLV supplement. So, with that being said, that's not the end. Wait, there's more, right? I hope you guys downloaded the notes, because as you can see, we've already gone over our hour mark, but there was so much information that we needed that we wanted to share with you. But if you look at the notes, if you look past the resources that we used, there's 3 more pages of notes of material that wasn't even covered in here, but I think it was material that we thought was important that we wanted to get into your guys' hands. So if you haven't downloaded those notes, go ahead and download them, because it's there's some really good information in there. And with that being said, that brings us to the end. And now we can go ahead and answer some of your questions. So, Sean, have you been looking at the questions as people been
Yeah, I've been trying to reply, so that's why some of my responses have been a little slow or choppy.
Okay, that's fine. Are there any questions that we haven't answered?
Not that I'm aware of.
I have a question that I might have missed, and I apologize if I missed it. But when we were talking about the interaction of the essential oils with medications,
Yeah.
I also wonder, do I need to be concerned or learn more about interaction with herbal medicines or vitamins, such as like vitamin C or D or zinc or turmeric or anything that I like to take on a regular basis?
Yeah, there's all those interactions do come into place. Herbs also are bioactive, so there are potential interactions. Turmeric, it's a fairly benign one. There's not many that it runs into problems with, but it is has the potential for blood thinning. So again, if you have any upcoming surgeries, the same way with the LLV, and that's one thing that Dr. Riggs said last night. Turmeric, dual caps, and the LLV stop at 2 to 3 days before surgery and 2 to 3 days after surgery, pick up again.
Okay, all right. Thank you.
You're welcome.
I just had a question also. Can you hear me?
Yep, we got you, Lori. Go ahead.
Oh, okay. I was just saying, I take a half dose of LLV because it's pretty pricey. I mean, should I try to take more than that? I don't know. You know, I do I do it in the morning. I take the morning dose. I don't do afternoon.
Okay. So the reports that I've read from this is if we give our bodies a dose in the morning and in the evening, our body is better able to regulate, absorb, and utilize those nutrients and those supplements because it knows it's going to get more later on. Here's the telltale sign. If you're wondering, if you think they're doing good, but you're not sure, stop taking them.
Oh,
promise
I
you, you'll start
have.
to
I've run out. Oh, I know.
Okay,
I've
so what I would
yeah.
do is give yourself maybe a 7-day period where you take the AM and the PM dose. See what happens. Some people can get by with half a dose, but what they'll do is they'll take one of each pill in the morning and one of each pill in the afternoon or evening. That's another way to do the half dose. It takes a little bit of playing around sometimes, but you got to figure out what works for you. So just, kind of play around with it.
And
I
is
like,
there a recommended evening time to take? Like, do they say, does it like have to be a dinner? Can you take it before bed? Is there a certain time you shouldn't take it after?
We take ours with the evening meal, but some people need to take it in the afternoon because they're not able to get to sleep at night. They're still a little bit too active.
Yeah,
I know
that
people
alpha-
that will not take the Mito Max after 2 p.m. because that's gives your body extra energy, and that's just at 6 o'clock at night. They're not going to take a Mito Max because they know they're not going to get to sleep. So it takes a little bit of playing around. That's the good part about using the nutrients and the oils, and that's kind of the bad part about it too, because we're trying to always trying to do something. Sean, do you want to add something to that?
yeah. If instead of, I like having those vitamins and everything else that comes in the LLV to be given throughout the whole day. So if you're only taking half the dose, I would split it, as Angelo said, and I've had some customers that are really sensitive to the components, and literally they take a half a dose, one of each in the morning and one of each in the evening.
Okay.
I also think that if possible, if you can take it with food, because the body is now realizing, oh, I got something that I really need to absorb. And I think you have better availability, because if you like take it at bedtime, the body is trying to go in now into a slower absorption, and it's going to now be distributing. There's some thoughts out there on that, and so I think it's better with food. The other thing is, some of those, because those vitamins are so powerful, and the omegas, some people complain about burping back, but if you have food in your stomach, it minimizes that. Angelo?
Okay.
No, that's yeah. If there's issues with the LLV, there's always something we can consider trying to do. Sometimes it's as simple as taking a Terrazyme to help assist with that.
Yeah.
That doesn't bother me.
Okay, good.
Yeah.
So Lori, just play around with it a little bit. See
right,
what
thanks
works
so much.
best for you.
Okay. Thank you.
Yep, you're welcome.
I have a question.
What do you got?
Sean, your 2 rollerball recipes that you put up.
Yep.
Where do you roll them? Like, how do you use them physically on you?
Okay, so I use the great toe, and then on the inside of my foot along the length, using the reflex points, because it's hitting all those nervous system points.
Okay.
So
So basically from the big toe to the heel all the way down?
yep. Yeah, I'll rub it on the big toe and then I stripe it down. So about 4 rolls around on the big toe, and that up and down the instep to the heel about 4 times.
Okay, thank you.
You're
that was
welcome.
my question.
Yep.
All right. So any other questions before we cut out? I hope you guys found this beneficial. I hope you found it useful. Please, if you guys have any other questions, don't be afraid to reach out to us. Again, we will help you out with anything that we can. Thanks for jumping on board and hanging out with us for a little bit longer than anticipated, but you guys are awesome. Thanks for participating with this. We love the questions you guys got. Take care. Go on and enjoy the rest of your night, and we will catch up with you guys again soon. I'm going to post this on our Facebook group tomorrow at some point. So if you missed the recording or want to rewatch it, you'll have that opportunity. All right.
Thank you so much.
All right.
Thank you. Good night.
See you next
Welcome.
time. Thank
Thank
you,
you.
Sean.
Have
Have a
Thank
good
you,
night,
Angela.
guys.
You're
Take
welcome.
care.
Thank you.
Bye.